use of selective serotonin-reactive inhibitor during pregnancy and risk of outage. Definition: prenatal exposure to selective serotonin-reactive inhibitor medication, frequently described to treat depression, anxiety, and other mental health disorders, is associated with a higher incidence of autism spectrum disorder and developmental delays. Application in nursing. The symptoms are mental status change such as agitation, poor concentration, confusion, and hallucination. Automatic instability manifests by delayed pupils, arrhythmias, and fever. Neuromuscular hyperactivity such as leg irritability, tremors, hyperreflexia, incoordination, and attacks.
Next, imagine that you fit into that specific human population segment and are possibly susceptible to the highly increased risk of the negative effects seen in animals caused by drug X. Then imagine that there are known alternatives to drug X, such as exercise, that have been found to be beneficial and possibly even more beneficial than the drug. Finally, imagine that studies have shown that a placebo is just as effective as the drug X that you've been taking. How does all of this make you feel about drug X? Now let's take a look at a real-life scenario that goes on today. Selective serotonin reuptake inhibitors, SSRIs, are often found in antidepressants. These antidepressants are believed to affect serotonin. Now, in a developing embryo, serotonin plays a critical role in the brain's development, and many believe that autism is characterized by changes in the serotonin system. Therefore, it seemed reasonable that taking these antidepressants during pregnancy might affect a developing baby's brain formation. Regarding these antidepressants, Dr. Adam Segurato said, "It really shouldn't come as that much of a surprise, given that numerous animal studies have shown that exposure during development leads to changes in the brain and changes in behavior, changes that often mimic autism." Authors of the mentioned animal studies warned that their findings of harmful effects should concern us when using these drugs on humans. Only 2 studies have been completed on the links between autism and antidepressants in humans. The first study, a smaller one published in 2011, found that children whose mothers took antidepressants are twice as likely to have autism. A study recently published in the British Medical Journal surveyed a much larger group, and it found that the use of antidepressants was associated with a risk of autism 3 times that of women not taking those drugs. The authors of these studies were cautious with their words, as no one has conducted a randomized controlled trial, RCT. An RCT can most accurately assess causation. Now, to conduct an RCT, pregnant women would be required to take antidepressants in order for researchers to evaluate the effects on their babies. However, ethical issues have discouraged studying the negative effects of antidepressants during pregnancy. It's fair to note that an RCT is not always necessary to presume that a problem exists. For example, no randomized controlled trial was conducted on cigarettes, yet nearly everyone acknowledges that they cause harm. Regarding pregnant women taking antidepressants, the latest studies suggest that non-drug approaches such as psychotherapy or exercise may serve the mother just as well, or perhaps even better than the antidepressant. Finally, after years of research, there is little evidence that suggests that the antidepressants are clinically more effective than a placebo.
Pros and cons. Pros: help to stabilize moods and are often an effective treatment for disorder. The cons: these antidepressants cause several possible side effects, and the most common are gastrointestinal, such as nausea, indigestion, abdominal pain, diarrhea, and constipation.
Hi, I'm Betsy Kim, editor editorial director of Lawyers.com. Harris Pogus is a partner at Pogus, Breslow, and Milrod in Philadelphia. He represents hundreds of people in litigation involving SSRIs. What are SSRIs and what are they prescribed for?
SSRIs are drugs prescribed to, unfortunately, or to millions of people across the country for depression, ranging from mild depression to severe depression.
Can you describe some of the problems where people have sought legal help?
The current case involved women who took various SSRIs during their first trimester and had children with various birth injuries, including heart defects, limb defects, and various other birth injuries. Skull malformations, various heart defects, club feet, autism. There's a link to autism with SSRIs being given during pregnancy.
Can you describe any of the studies or evidence that is linking the SSRIs to the birth defects in children?
Clinical trials from the manufacturers themselves show it. So the evidence is there. We're in the middle of discovery, getting documents and information from the defendants, and the defendants are gathering information regarding the plaintiffs and their mothers' histories, and for reasons that they believe the injury was caused to the fetus, and it's right in the middle of it. This is not a fleeting issue with these children. They're going to unfortunately have a lot of medical issues throughout their lives, which cost a lot of money for these families to care for, and the responsible party should pay for that, which, in our opinion, is the manufacturer of the drug.
Thank you very much. We really appreciate your stopping by and speaking with us.
My pleasure. Thank you.
I'm Betsy Kim, reporting for Lawyers.com.
Use updates in Ecuador. Pregnant women during the gestation period inhales antidepressants SSRIs type increase the risk that your child suffer from an abnormal brain development and condeveloped autonomy, according to a Dutch scientific study.
SSRI antidepressants used in pregnancy may be associated with a number of birth defects. Selective serotonin reuptake inhibitors, or SSRIs, are prescribed to treat depression, anxiety disorders, panic attacks, and personality disorders. The first antidepressant drug in the SSRI class hit the U.S. market in 1988 under the brand name Prozac. By 2005, antidepressants like Prozac have become the most prescribed drugs in the country. Other SSRIs are sold under the brand names Celexa, Lexapro, Luvox, Paxil, Wellbutrin, and Zoloft. Published in the Journal of the American Medical Association, researchers from the University of Pittsburgh in May 2005 estimated that in any given year, over 80,000 pregnant U.S. women are prescribed SSRIs. A number of lawsuits have been filed against the manufacturers of SSRIs. The plaintiffs in these SSRI birth defect lawsuits are claiming that the drug manufacturers failed to warn patients about the possibility of infants of these mothers developing birth defects, including heart defects, persistent pulmonary hypertension of the newborn, or PPHN, skull defects, cleft lip or palate, limb deformities, genital and intestinal defects. In October 2009, a jury awarded a family $2.5 million in a Paxil lawsuit filed against GlaxoSmithKline. That alleged Paxil was responsible for a young boy's birth defects. In July 2010, the company reportedly settled around 800 Paxil birth defects lawsuits for approximately $1 billion. As of early 2014, there were over 475 Zoloft lawsuits on file. Our goal at Mall Law Group is to inform consumers of potentially dangerous products and provide assistance with the filing of claims. If you you have a case and would like a prompt and confidential evaluation, contact us at malllawgroup.com. For free consumer safety information and case updates, visit us at legalnewsnetwork.com.
In this short video, I am going to review side effects of selective serotonin reuptake inhibitors. This is Flavio Guzman. I am a medical doctor and the editor of pharmacologycorner.com. I'll start by reviewing some facts about SSRI therapy. The first one is that patients tolerate the SSRIs better than tricyclic antidepressants. This is because tricyclics have anticholinergic properties. Most of SSRI side effects are acute. They tend to diminish over days and weeks. And these side effects include nausea, diarrhea, cramping, heartburn, and other symptoms of GI distress. We're going to classify side effects according to the system that they affect. First, we are going to review gastrointestinal side effects, then central nervous system side effects, and then sexual dysfunction induced by SSRIs. Nausea and vomiting is caused by stimulation of serotonin 3 receptors located at the hypothalamus and the brainstem. Effects on the GI tract are mediated by stimulation of serotonin 3 receptors and serotonin 4 receptors. This stimulation can lead to increased GI motility, GI cramps, and if the increase in GI motility is severe enough, it can lead to diarrhea. CNS side effects at the basal ganglia are mediated by serotonin 2A receptor stimulation. Stimulation at the basal ganglia of these receptors can cause akathisia, psychomotor retardation, Parkinsonism, and dystonic movements. Mental side effects are the second group of CNS side effects. Stimulation of serotonin 2A and 2C receptors can lead to mental agitation, anxiety, and panic attacks. And finally, regarding sexual dysfunction, patients may complain about diminished libido, anorgasmia, impotence, and delayed ejaculation. For more
Conclusion. In order to explore the both SSRIs and non-selective nominally reactive inhibitor was association with an increased risk of autism spectrum disorders, particularly with intellectual disability. Whether this association is causal or reflects the risk on autism with severe depression during pregnancy requires further research.